All right, guys, I am back. And now I'm going to go over the answers to the diagnosing and case studies questions that were given to you in the last video. All right, so we talked about this 30-year-old male that presented with that 6-month history of persistent low mood, loss of interest, activities, difficulty sleeping, so forth. And the answer for that one is major depressive disorder. Now, some of you might have said, that's a no-brainer. That's pretty easy. It was straightforward. You were able to differentiate why it was major depressive disorder versus the others. But what I suggest you do when you get a question like this, and it's really easy, still understand the other diagnoses and why it was not that one. So why wasn't it bipolar 1 disorder? Bipolar 1 disorder has manic symptoms also. Nothing in this scenario showed that this client was manic. So I probably would have just ruled that one out. Generalized anxiety disorder. It didn't talk a lot about that constant thinking and all the things that are persistent thinking or overthinking, I'm sorry, when it comes to generalized anxiety. And that's a key factor. So I probably would have just threw that out. Persistent depressive disorder, the key thing here and why some people might have got mixed up with those two and not sure. The reason it's not persistent depressive disorder is because of the duration. So when I go through these questions, I'm going to go through the duration and the key features because some of these have very similar symptoms. However, the duration determines which diagnosis is which. So in question number 1, the duration for major depressive disorder only has to be at least 2 weeks. That's it, just 2 weeks. Persistent depressive disorder, you have to have it for 1 full year if you're a child and 2 full years if you are an adult. So keep that in mind. Similar symptoms, but the duration made all the difference. Also, in this one, they have persistent feelings of sadness, emptiness. You're looking at that. It didn't really talk too much about the sadness, but it did say on here it was that low mood, loss of interest, and the difficulty sleeping. Now, when you're trying to diagnose a major depressive disorder, there is a certain amount of criteria that you must meet. However, when you're taking a question or an exam, it's going to give you little snippets of the diagnosis. So it's not going to give you all the criteria and everything, but it's enough to let you know that's definitely the answer. Moving on to question number 2. This is the 25-year-old was having a recurrent panic attacks and worried about having more panic attacks and avoiding places where they previously had panic attacks. So in this case, you can see the ongoing theme, which is kind of in the answer, and that is panic disorder. That is the correct answer. Panic disorder, the duration is recurrent. And as you can see, the first sentence said the 25-year-old female experienced recurrent. So that kind of gave it away. Also, the unexpected panic attacks are followed by at least 1 month of concern about having more. So they gave you that in the scenario where it says the attacks have been over a month. So these are some of the things you want to look at. So again, these questions might be simple, but you got to be able to tell when you're a clinician and you work on that, having that LCSW, it's going to be expected that you can dig a little bit deeper, not just say, oh, that's a panic disorder. Why is it the panic disorder? What are the key words in there that gave it away to let you know it was one diagnosis over the other? Some of the key features: sudden, intense fear or discomfort. You have the heart palpitations, the trembling, the shortness of breath, dizziness. These are all associated with panic attacks. And these are the things you want to kind of know or think about when you're answering the questions that deal with panic attacks. Of course, agoraphobia, social anxiety, these are all very common diagnoses that you're going to see again. So even though you're taking this question, you automatically said it's panic disorder. I got that. I would encourage you to pull out your DSM and write out the differentials. Why is it not agoraphobia? Why is it not social anxiety? Is it a phobia? Why is it not? These are the questions that you want to ask so you can continue to learn and elevate in this area when it comes to diagnosing. Question number 3. I believe many of you got this without even the first sentence, that inattention, hyperactivity, and impulsivity, you automatically jump to attention deficit disorder. Now, one of the key features that I want you to pay attention to is that I also said the child was 7. So the symptoms have to be present for at least 6 months. That's the duration. And it said it right there in the case study. And it must be before the age of 12. So if I would have said this child, a 13-year-old child, shows persistent pattern of da 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 and went through everything, it doesn't mean the question's wrong, but it might make you think twice because we're diagnosing someone with something that is after the age according to the DSM-4. We want to observe these by the age of 12. You should see some of these symptoms. And of course, you have all the key features. I'm going to scroll down so you can see that. These are the key features for ADHD, which is a very common diagnosis. So I'm sure many of you have seen it, heard it, or kind of know exactly what to look for when you're dealing with clients with ADHD. Question number 4. A 40-year-old woman reports persistent and excessive worry about multiple aspects of her life, including work, finances, health, and she's had a difficult time controlling this over the last year. What diagnosis best fits this presentation? Again, this is a dead giveaway. The question number 1, I believe, we were talking about the client having depressive disorder, and generalized anxiety was one of the options. However, this is the key, that persistent and excessive worry. That automatically puts you in that anxiety disorder realm. However, social anxiety is also listed up here. So why would we have not chosen that one? Again, it's not really talking about the person in the social environment. It's really specific in steering that she has excessive worry about a lot of different things in her life. It's not just in that social realm. Excessive worry and anxiety has to occur more days than not for at least 6 months. So during a 6-month time frame, this client is dealing with excessive worry a lot more than not during that period of time. So that is the duration. And again, guys, remember, you can always pause these videos. You can stop. You can take notes. You can take screenshots, all those things if you need it. I haven't had any requests to actually send downloads or just put them in the actual descriptions. However, that is something I can consider down the line. But right now, I just want you guys to get the content and make sure that it's working for you so I can decide which direction to go moving forward when it comes to other things. All right, question number 5. We got a 50-year-old male, hearing voices, delusional persecution, and they've had it for at least 3 months. What is the most likely diagnosis? I'm a fan of psychotic disorders, guys. So this right here is kind of like screaming at me. And I want to spend a little bit more time on this question. We'll do other presentations and things on diagnosing and specifically psychotic disorders. But in this case, it says the symptoms for, because the answer is schizophrenia, it has to be present for at least 6 months. I'm sorry. Yeah, it has to be persistent for at least 6 months with at least 1 month of active symptoms. So sometime in the 6-month period, that client had active symptoms of the schizophrenia, which is hallucinations, delusions, some negative functioning, like the cognitive impairment or maybe lack of motivation, flat affect, things of this nature. They're showing that and displaying that for at least a month within that 6-month duration. Now, schizoaffective disorder is pretty much the same exact symptoms as schizophrenia. You just have that affective disorder, which lets you know it's that mood dysregulation in there. So that is kind of how it separates that diagnosis from the other. Brief psychotic disorder, again, the duration gave it away. Same symptoms pretty much as schizophrenia, but a lesser time frame. And then they don't have schizophreniform up here. And you normally don't hear people talk about schizophreniform too much. However, that is also pretty much the same symptoms as schizophrenia, just a lower time frame. So you want to be mindful of all these things when you're taking the quiz or taking questions and you're preparing for the exam, to make sure that you understand those durations, because that can make all the difference when you get a question and you're trying to answer it. I hope this was super helpful for you guys and you're able to share it with a friend or study with a friend and use these questions and use this content. Remember, I'm doing this for you guys. It's a vibe over here, and I'm just hoping everybody catches it so they can also obtain those 4 letters, LCSW, behind their name. It is life-changing. I'm super excited that you decided to join my channel and support me on this journey as I support you in your journey. This is a process. We're helping each other out, guys. So be blessed. Until the next one, if you have any questions or you want to see certain questions or contents on something else, please hit me up in the comment section. I will read each and every comment, and I'll make sure that I'm answering and moving forward in the things that you guys need. Until the next one, don't forget to subscribe. Don't forget to like, and I'll talk to you guys soon. Be blessed.